So even listen, New York Times is posting this. Dude. C.D.C. labs were contaminated. Delaying corona testing, officials say. Tried to tell you guys. Tried to tell you. Posted April 18th, by the way. Sloppy laboratory practices at the Centers for Disease Control and Prevention caused contamination that rendered the nation's first tests ineffective, federal officials have confirmed as of Saturday, 2 days ago. 2 of the 3 C.D.C. laboratories in Atlanta that created the test kits violated their own manufacturing standards, resulting in the agency sending tests, meaning test kits, that did not work to nearly all of the 100 state and local public health labs, according to the FDA. Early on, the FDA, which oversees laboratory tests, sent Dr. Timothy Stesnell, chief of vitro diagnostics and radiological health, to the CDC labs to assess the problem. Several officials said he found an astonishing lack of expertise in commercial manufacturing and learned that nobody was in charge of the entire process. Problems range from researchers entering and exiting the laboratories without changing their coats to, and I can't read the rest, please sign up to get a subscription, New York Times. Although, hold on, let me check something. I may have lucked out. Yes, I got a little bit more. Problems ranged from researchers entering and exiting the laboratories without changing their coats to test ingredients being assembled in the same room where researchers were working on positive viral samples, corona specifically samples, officials said. Those practices made the tests sent to public health labs unusable because they were contaminated with the coronavirus and produced some inconclusive results. In a statement on Saturday, a spokeswoman for the FDA, Stephanie Kakamo, I want to take you to Kakamo. We'll get there fast and we'll ship the test kits fast and then we'll take it slow. That's where we want to go. Let's see what Miss Kakamo said. CDC did not manufacture its test consistent with its own protocol. End quote. The FDA confirmed its conclusions late this week after several media outlets requested public disclosure of its inquiry, which assertedly is part of a larger federal investigation into the CDC lab irregularities by the Department of Health and Human Services. Forced to suspend the launch of a nationwide detection program for the coronavirus for 1 month, the CDC lost credibility as the nation's leading public health agency, and the country lost ground in ways that continue to haunt grieving families, the sick, and the worried well from one state to the next. To this day, the CDC's singular failure symbolizes how unprepared the federal government was in the early days to combat a fast-spreading outbreak of a new virus, and it also highlights the glaring inability at the onset to establish a systematic testing policy that would have revealed the still unknown rates of infection in many regions of the country. The blunders are posing new problems as some states with few cases agitate to reopen and others remain in virtual lockdown, with cases and deaths still climbing. This is a New York Times article I'm reading you right now. Yeah. Fake news. We hate Trump. Scary, scary, scary virus stories of all the hospitals. New York Times. The same New York Times who was able to get a reporter with a camera inside the emergency room in, I forget if it was Queens or Brooklyn, whatever hospital it was. It's an apocalyptic scene, and here the doctor's walking them around. Whoa, aren't you violating HIPAA left and right? All the doctors being asked as they walk out of the hospital, isn't that a blatant, yeah, that's definitely a HIPAA. It's on TV right now. How do you think that Dr. Judy, whatever, I say Judy, I don't remember her name, Amy or somebody. Yeah, I don't know. You have to ask her. She's in the hospital. I don't want to talk. Okay. The numbers are so wrong, from deaths to people that may or may not have it. Everything's unreliable. All data points are unreliable. And that was the biggest thing that I have been bringing to you. I'm still willing to say, given the proper data, this thing was manufactured in a lab in Wuhan, China. It escaped. Give me the data. And I might run with that story. I might actually change my mind. But right now, it's failure after failure, contamination. Not only that, I brought you the story, it must be a month ago now, I don't know. Maybe not a month ago, 3 weeks ago, I don't know. UK, breaking news, all these damn test kits are contaminated because there's a couple pieces from this company, a couple pieces from that company. We make the whole test kit, but that one key thing, that's the problem. And by the way, it's not just us, it's the other companies because they use that same part. We're all contaminated, the test kits. So I just did a video you saw yesterday, Boston clinic for the homeless. I think it was Boston, whatever. Massachusetts clinic for the homeless. Everyone's testing positive, but no one has symptoms. They're asymptomatic. Asymptomatic. That's the new catchphrase. Didn't you hear it? It's a new cool word. Asymptomatic. Yep. Asymmetrical and symmetrical. Asymptomatic, symptomatic. Ooh. So people might have it and don't even know they have it. Yeah. And everyone's testing positive. Yeah. If everyone's testing positive and nobody even knows they have it, are you sure you're testing for this damn thing? Or are you testing for something else that you knew would prove a positive result in the test kit? So that you could just say how bad it's spreading. Everyone's getting it. Oh my God. Oh, everyone stay home. One of the test kits, types of tests, again, searches for some type of antibody. If it's present, you have had, or might have, currently, coronavirus. Yes, you might have had it previously, years ago even, or you might have just gotten it, and your body has fought it off, and there's that specific antibody T cell, or whatever they call it. What the hell does that mean? Well, it means you might have it right now, but it also might mean that you had it previously. Like 10 years ago, 5 years ago, yeah, we don't know. Your body fought it off one time. Now this T cell's left behind, or this antibody. And again, this same C.D.C. that I'm reading you right now about in this damn article, the top health organization on the planet, or at least in America, they're the ones that gave out the guidelines, remember? Official release number 2 and official release number 3. I want to go find them. One more time. Stand by. Because we got to talk about this. I got to keep showing you this so that you can share it with your friends who are just not awake. Look at the website on my screen. CDC.gov. This one is alert number 2. New ICD code introduced for COVID-19 deaths. And remember, hospitals are getting, no questions asked, if you write down the word COVID on a death certificate, instant $17,000 paid for by Medicare or Medicaid. If they needed the tube, or whatever, the breathing apparatus, what is it, $39,000. And as I keep saying, before you rush to conclusions, Joe, these are professional doctors. You think they're going to lie about someone's death certificate? What difference does it make if someone's having some type of breathing problem, which could be a flu, pneumonia, God knows what else, corona, and they realize if I put anything else down other than corona, I may not be getting paid from this person. Hospital needs the money. Does it really matter if I put down pneumonia or if I put down COVID? No, they're both respiratory problems. Who cares? We're going to get paid. The hospital needs it. And not only that, the CDC guidelines are telling me to do just that. Let's look at this. It's on the screen. This is the document. And you can search for this on Google if you want to try to find it quickly. COVID-19 Alert 2, number 2, CDC. New ICD code introduced. What is the new code? When will it be implemented? Right away. Again, this was March 24th. They wanted this out right away. Will COVID-19 be the underlying cause? The underlying cause depends upon what and where conditions are reported on the death certificate. However, the rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not. Why? Why? Says who? You're diagnosing people on a piece of paper that you're going to issue as guidance? How the hell do you know? Someone coming off a car accident, oh, my lungs punctured. Oh, well, got a breathing problem, COVID-19. What happens if certifiers report terms other than the suggested terms? If a death certificate reports coronavirus without identifying a specific strain or explicitly specifying that it is not COVID-19, NCHS will ask the states to follow up to verify whether or not the coronavirus was COVID-19. As long as the phrase used indicates the 2019 coronavirus strain, SCHS expects to assign the new code. However, it is preferable and more straightforward for certifiers to use the standard terminology COVID-19. Again, there hasn't been a test yet that can say COVID-19 versus coronavirus. The tests they were giving out, yes, besides the contamination, we're a month behind because we effed up at the C.D.C., or did they really F up? Is this all part of a big game? A big plan? Oh, it's just people didn't know what they were doing. Incompetence. It's always that. It's always, every time we catch them with their pants down, it's incompetence. We're going to get a committee together. And in the committee, we're going to have them investigate and come out with a report. No later than 6 months from now, we'll have the final report. That's what they do with everything. What happens if the terms reported on the death certificate indicate uncertainty? If the death certificate reports terms such as probable COVID-19 or likely COVID-19, these terms would be assigned the new ICD code. It is not likely that NCHS will follow up on these cases. So you can put it down. We're not even going to follow up. We're not going to check anything. Just put it down. Everything's good. If pending COVID-19 testing is reported on the death certificate, this would be considered a pending record. In this scenario, NCHS would expect to receive an updated record, since the code will likely result in R99. In this case, NCHS will ask the states to follow up to verify if test results confirmed that the decedent had COVID-19. Do I need to make any changes at the jurisdictional level to accommodate the new ICD code? Not necessarily, but you will want to confirm that your systems and programs do not behave. Remember, okay. Should COVID-19, this is the final one, and this is the big one. Should COVID-19 be reported on the death certificate only with a confirmed test? COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. If the decedent had other chronic conditions such as COPD or asthma that may have also contributed, these conditions can be reported in Part 2. See attached guidance for certifying COVID-19 deaths. So those conditions can be reported in Part 2, whatever that is. But the primary thing it's telling you, put down corona. And they bolded it. Again, they bolded it. If the disease caused or is assumed to have caused or even contributed. Again, that could be person comes in, punctured lung, car accident, they got their lung issue, whatever. But they were feeling a little sick. Oh, they said they were not feeling too good. Okay. Write down COVID. Even if they didn't say that, doesn't matter. They can put down COVID. And again, there's a slight monetary incentive there. Instant $17,000, possibly an additional, or I don't know if it's the total or an addition, $39,000 if we put him on the ventilator. What difference does it make? He's got breathing problems. Does it matter if someone put down he died of the flu, he died of pneumonia, he died of corona? He had a disease. So what? Our hospital's getting paid. We're having to send people home right now. Hospitals are in trouble financially right now. They're sending so much staff home and there's no business. It's insane. Right now, across this country. Let's go to number 3 and final. COVID-19 alert number 3, April 2nd, about a week later. New releases final guidance in provisional death counts. Important notes about provisional death counts down here. But we're going to start here. Pneumonia deaths are included in the provisional counts because deaths due to COVID-19 may be misclassified as pneumonia deaths in the absence of positive test results, and pneumonia may appear on death certificates as a comorbid condition. And we know the test kits have a problem. The C.D.C. effed up. The company out of the UK or wherever the hell it was coming from, they effed up, contaminated. Everything's contaminated. And we just got the final word of it being contaminated 2 days ago, Saturday, April 18th. Today's the 20th. So all these deaths, New York's still skyrocketing. Other places are flatlining, but New York is going up. Are you sure? With God knows what being labeled as coronavirus deaths? And yet the numbers are still terribly low. I was watching a little bit of the live stream tonight on Trump. I recorded it. I want to go watch the rest of it. They had Dr. Birx up there, and she's basically looking like an effing moron. And I'm hearing words like, we have the models, but we don't actually have any data, so we don't really know. And I'm like, I'm sorry, what did you just say? What did she just say? We have numbers similar to the flu, Well, and she got into the test thing too, and the problems with the test, She's telling you right to your face too. There's problems with the test, they're unreliable. So if this thing was a bio weapon, they are trying so hard, so out of their way to increase the numbers. Like, I've never seen anything like this in my life. Nothing even comes close to how hard they're trying to falsify numbers of deaths all towards coronavirus. With the C.D.C. guidelines telling you basically to do that. They're not using the word false to go ahead and falsify it. They're just telling you, if you think maybe, or maybe they haven't and contributed, or maybe whatever. If you think as the doctor they have corona, just put it down. And right now, if you're a doctor and you're watching the news and hearing everyone's talk, everyone's out of control, everyone's wearing masks, the only thing you know right now, it ain't no flu messing around, ain't no pneumonia, it's corona. Corona's everywhere. So anybody that comes into your hospital, I'm having problems breathing, I've got a fever, oh shit, you've got corona. They're going to tell you got corona before you get a test, before you get anything. And again, we got some tests here, sir, give them the test. Where'd those come from? The good batch or the effed up batch? I don't know. We just got them in. Who knows where they came from? You think the C.D.C. isn't following its own guidelines and contamination stuff? They got some homeless people off the street working there. Hey guys, you need a job? I'll give you a job. Is that where our hard-earned tax dollars are going? To morons running things? And I'm not talking about just politicians, because those are some morons. But the people that have the degrees from college, PhDs, you name it. Those are the people who don't know what the hell they're doing. Those are the professionals. See, a politician is an effing politician. Get on camera, lie to your face, make you think I know shit I don't know, and I'm going to get in here, and when I leave here, I'm going to be effing rich. And I'm going to sell you out as fast as I possibly can while smiling to you and lying to your face. That's what a politician does. That's a politician. They don't have to go to school. They don't have to go to college. Anybody can be elected. But not anybody can get in the C.D.C. Some jabroni off the street. And these people don't know how to run a freaking laboratory and create test kits. Everything's contaminated. Are you kidding me? We're supposed to believe this? We shut our country down. And by the way, I got my little letter in the mail today. Your mortgage company, from April 1st to June 1st, you don't have to make your mortgage payment. However, there's three options. There's three options. One, when this is all over, you pay back everything that you got the break for. So if you didn't pay for 3 months, you need to pay 3 months all up front at the end of this 90-day period. Two, option two, you work with your lender to come up with some kind of deal, some kind of agreement. It said, it didn't even say what. Option two, work with the lender to come up with something, some kind of agreement. What is that? Option number three, pay the entire thing off. I could have swore we were told your payments were going to go on the back end of your mortgage. Nothing's going to affect anything. And that's it. Like I said, I signed up. Oh, you need this document, that document, proof of this. I don't want to deal with it. I'm not going to go through with it. Automatically, you're approved. So tomorrow, I'm going to have to call them and say, no, unapprove me. I never continued it anyways. Unapprove me, put me back. My payment went through anyways for April. Go ahead and let it go through for May too, because what is option number two? You didn't even give me an option. Option two is work with your lender on some agreement. Well, what the hell does that mean? What's the agreement? So I got it again. If that's what's happening, and it is, and I've heard other people talking about this too, this exact scenario I just gave you, that means everybody's getting that. Nobody's getting the old, oh, we'll just tack it on to the end and everything's good. Just as soon as 90 days is up, just make your payments again. No one's getting that. So if nobody's getting that, and there's an incredible amount of people on unemployment, the defaults are going to be unprecedented. And again, I don't think Trump's just going to let that happen and everyone get kicked out of their house. Ain't no way under Trump. And I'm thinking, quite possibly, again, the big reset we keep hearing about. And I was talking to one woo-woo friend of mine today. It's actually a dude that he's been following me for a while, but I didn't realize he was a woo-woo friend. And did a little research on him. He is a woo-woo friend. But he said, Joe, I'm reaching out to you. Spirit wants me to tell you something. Talk to you. So I had a 2.5 hour conversation with him today. And one of the things we talked about was this. And one of the things he said, he goes, what I was getting, woo-woo, spirit download kind of a thing, is that it's kind of going to be like when, and then he goes, I'm not sure how soon, obviously, but in relation to all this, the financial catastrophe, everyone, these people out of work, reset, what's going to happen? He said what he was getting is it's kind of one of those things with whatever you have, you now own. So it doesn't matter if you're making payments on it. When this is all said and done, it's going to be yours free and clear. That's kind of what he was getting. So house, car, whatever, payments, it may get wiped out somehow or whatever. I'm not sure. He didn't say how either. But, and again, is he going to be dead on right? Does he have 100% accuracy? I doubt it. Nobody does. But he'd tell me some pretty interesting stuff. I'll tell you that. Long conversation. But, and even him, one of his thoughts on this virus, he goes, what I think happened, which he said was basically his guides telling him. And he said, I think there were people in laboratories working on stuff, biological, diseases and things. And it was different countries, different groups. And they would kind of, okay, we've got it, we're going to do this with it. Okay, pass it to the next group. Okay, they got it, they're going to do this with it. Next group, okay, they got it, they're going to do this with it. And by the time it got to Wuhan, one of the other groups put in there something that would go after heavily Asian people DNA, and he said black people. But I haven't really been hearing much about black people in coronavirus, especially in the country of Africa. Like, it's almost non-existent. I know there's a few, things you hear about it now, but not much. But we did see the Asian thing hit right off the bat. So again, is he going to be dead on accurate? I don't know, but that was a new one that I hadn't quite heard yet, where individual groups were working on it, passing it to the next one, passing it to the next one, and then one of them didn't tell anyone what they were working on, and set this thing to go after essentially Asian people. But again, we have a lot of Asian people in our own country. and so do these other countries, including the EU and you know, the Eurozone and, you know, but basically Europe. And we're not, you know, again, all the hospitals, no one's really reporting, oh, there's a lot of Chinese people coming, a lot of Asian people coming in. It's just average people that are typically older, just like the flu. So, you know, again, what do we do with this information? This is a woo-woo person, first of all, which I trust and respect my woo-woo friends, but they're not always right. And, you know, I'm showing you the guidelines from the CDC. This is indisputable what I've got here. This is the kind of evidence I'd love to have. Like if he gave me something, oh my God, there's a secret document in the CDC that talks about passing this thing on to the Iranian group, then they're going to pass it to the North Korean group, or whatever. And I got this document, holy crap. Cliff High, biological, dude, you were right. Jay Snip's got egg on the face. Dude, you were right. But we're not finding that. And if it was, again, why are they pumping the numbers up out of control? They would need no help. Let's let this puppy go. We'll all go to our elite bunkers, and we'll see you guys in a couple months. The rest of you peasants above ground. And like I've always said, what about their politicians they put in power that they've got blackmailed to do anything they want? You're going to give that up, potentially to get them the virus? Just doesn't make sense to me. At all. And that's why I keep showing you this stuff. Like, this is, you know, there's a million different reasons, or 5G, whatever. If it was 5G, flip it on. There's places in America that have it right now. Several. Flip it on. Continue the cases going up crazy. It's just not happening. So, you know, again, where's the truth? Somewhere in the middle? Is it even in the same room? Is the truth so, as I say, so much stranger than fiction that all of the examples we gave, actually none of those are right. Love you guys, including you, Jay Snip, but you're not right either. None of y'all are right. It's actually this, you know. Are we ever going to know? That's the next thing. Are we ever really going to know? And if our government comes out, oh, this is what it is, it's our official story. We nabbed the guy in Canada, and how do we know that's to be believed? We saw the government give 12 charges on these 12 Russian guys that were colluding to take down Hillary Clinton, and we're charging them. James Comey, Mueller, we're charging them. What just happened recently? We're uncharging them. We're dropping the charges because it looks like it was bogus. If that didn't happen, everyone would be thinking the truth is, well, we had these Russian guys that were involved in this thing. It's actually truth. Holy crap, there were Russians involved in this, and Joe, they've been charged, dude. It's not like these people weren't charged. You think our government's just going to charge people like that? Yeah, actually, I do think they are, because they're effing criminals in these positions of our government. And as a matter of fact, they removed the charges now that the deep state's being taken out of these key government positions. Why would they even do that? These Russians that probably don't even exist. They're probably fake names. But William Barr, reverse that. We have no evidence of that. It looks like it's fraud. So when the final story, you know, just like 9/11, the final 9/11 Commission report, this is what happened. Excuse me, you didn't even put World Trade Center 7 inside your effing report? That's the most disturbing one of all. One single beam gave way, according to the National Institute for Standard Technology, their analysis of everything that they got. One beam out of 24 gave out, it got a little weak from an office fire, and the whole effing building came down at free fall speed? That's like each floor giving way at the same time so that it doesn't even hit, it just goes down. And you left that out of the commission report? Well, you know, who were the commissioners? Oh, handpicked from the last criminal activity. Oh, those guys. Oh, gotcha. It's a whitewash. So the official 9/11 report, if you want to argue with your friend, they're going to grab that. Oh, it was a real terrorist attack, dude. Look, it's in the official report. It says so, man. Dude, why did they put Building 7 in there? I don't know. I'm not an expert. You need to ask this question. It's one of the most controversial ones of all these buildings that went down that day, mainly the Twin Towers. Why wasn't that a threat? It's one of the Solomon Brothers building. And then you find researching, oh, this guy, Kurt Sonnefeld, was that his name? Was a FEMA photographer. One of 3 people, he said, that was allowed to walk the site, World Trade Center, right afterwards. And is finding underground basement level stuff cleaned out, empty. And he's got video and pictures of this saying, scratching his head, stuff was emptied out of here. Why would there be empty stuff down here? Like, it doesn't make sense. CIA building down there. Hey, man. It's odd, isn't it? And he, after seeing what he had, fled the country to a South American country. I don't know if it was Argentina or where he actually went. I don't remember now. But he fled the country with his family. And the U.S. government was trying to get him extradited back. What the hell was on those pictures and video? Why did he flee the country? Because of what he saw. And he realized, oh my God, we were lied to. This is worse than I could ever imagine. The enemy is inside the gates. It's inside our government and has all the power. Oh my God, I got to get out of here immediately. That's what happened with him. So, on that note, take care.